Hi, Lisa. We are so glad that you have joined us at First Health. I think that your career speaks for itself. You're an incredible advisor and consultant, and you've done so much for the policy perspective in healthcare and making sure that people understand HIPAA, its implications, and moving the needle forward on all of these important issues. Why are you joining First Health?
I think, I've worked in cybersecurity in multiple sectors, virtually every sector that you could think of, but my heart and my spirit always comes back to healthcare. Most of us who work in the industry have a passion for it. We have organizations that we really want to help in terms of, protecting their data, becoming more resilient. And it's really, for the benefit of the ecosystem, for the benefit of the individual organization, but also for the benefit of the patient. And sometimes we are patients, our family, our children are patients. I think we have an invested time spent in the industry to help support their mission. Not just, the IT and the cyber related work, but the mission of the organizations themselves to transform healthcare. So being able to be involved with an organization that has that primary focus and has a mission that is related to, helping healthcare organizations is really important to me. And the team and the executives and my fellow board members, they bring a wealth of knowledge, a history, an experience in the overall health sector, the overall ecosystem that we're dealing with. They're able to bring those to bear, and also very focused sector-specific knowledge in terms of not only the regulatory environment, new regulations, new guidance, but also in what are the specific threats to the sector, and how do we address those. So when I look at this team, when I look at this advisory board, it's a real privilege for me to be involved in it. It continues my focus on a sector that's near and dear to my heart. So I'm happy to be involved. We are taking our collective knowledge, our collective experience, and we're really focused on aligning services for the organization that makes sense for them and that help them meet their goals, which are, primarily to improve resilience and to manage risk and to be making risk-based decisions. So I feel like this is a team of folks that have the right background and experience, and also the passion to make it work within the sector.
In healthcare, where it really is a joint effort from all departments, right? Is that how you're seeing it as well? Because I know that you still consult and you advise, and that's probably part of your mission as well, right?
The focus that they have on the sector, the focus that they have on the mission, but also understanding operationally how IT works, the migration of legacy systems, the new sort of sphere of interoperability and data sharing for the benefit of patients, but also protection of data. It's really, it takes all aspects of the backgrounds that we have. I mean, mergers and acquisitions is a perfect example. That's primarily a business function, but we see very serious cybersecurity implications when those types of business transactions take place. And so being at the table to understand cyber risk when you acquire and connect up a new company, and to be able to advise in terms of, well, how do you do due diligence for that, but also how do you integrate the new company into an operation that is protecting very valuable data and faces significant cyber risk. So yeah, bringing all of those backgrounds, unique as they are for each individual, to a collective solution space is a very exciting opportunity.